Hello everyone. I'm Esma, a nurse at a hospital specializing in alcoholism. Today, I'd like to look at the mechanism of alcoholism from the perspective of neuroscience. Alcoholism develops when you drink alcohol. But what is the root cause of alcoholism? Alcoholism is a chronic disease based on complex brain mechanisms and develops as a result of a complex interplay of the brain's reward system, neurodegenerative disorders, neurotransmitter balance, genetic factors, stress, and environmental factors. As this is a multifactorial disease, a multifaceted approach is required for effective treatment and prevention. The root cause of alcoholism is an abnormality in the brain's reward system. The main cause is abnormal stimulation of the reward circuit in the brain by alcohol. What is an abnormality in the reward system? Let's take a closer look at the reward system. This reward circuit is mainly composed of three brain areas. 1. Ventral tegmental area VTA. This area is rich in dopamine neurons and plays a central role in sending reward-related signals. 2. Nucleus accumbens NAC, rich in dopamine receptors and directly linked to reward experiences and feelings of pleasure. 3. Prefrontal cortex PFC, involved in reward evaluation, decision-making, and behavioral inhibition. The reward system is a neural circuit that is activated when we feel pleasure or satisfaction, and is mainly involved with the neurotransmitter dopamine. Alcohol intake increases the release of dopamine, causing a sense of pleasure. When this pleasure is repeated, the brain begins to crave alcohol. The reward system is a very important mechanism for people to live. When the reward system is stimulated, such as when you eat a delicious meal, when you are immersed in a hobby, or when someone thanks you, you feel satisfied and are motivated to repeat the action. Under normal circumstances, this is the driving force that makes people more productive and behave well. However, in addiction, this reward system is hijacked. If the reward system can be easily stimulated by alcohol or stimulants, without any effort or ingenuity, people will gradually give up on the effort and become dependent on addictive substances. This disrupts normal life and leads to the development of addiction, dependence formation, and search behavior. When addiction is formed, people begin to exhibit search behavior to seek stimulation of the reward system. For example, in alcohol addiction, if there is no alcohol at home, the person will go out of their way to buy some. This is a behavior to obtain the addictive substance, and is a characteristic of addiction. By repeatedly consuming alcohol, the brain's dopamine system adapts and the sensitivity of dopamine receptors decreases. This means that the same amount of alcohol no longer gives the same pleasure as before, leading to a vicious cycle of increased consumption in search of pleasure. Long-term alcohol consumption also causes serious changes in the structure and function of the brain. This phenomenon is called neurodegenerative disorder, which causes the strengthening or weakening of synaptic connections in the brain. Specifically, the neural circuits of the prefrontal cortex areas and the nucleus accumbens areas involved in reward processing change, promoting alcohol cravings and compulsive drinking behavior. The same is true for internet addiction and gaming addiction, which are caused by a hijacking of the reward system. Long hours of internet or gaming disrupt one's life, and often lead to disturbed sleep rhythms and a decline in physical function. This is also the result of the reward system deviating from normal sources of stimulation and becoming dependent on addictive substances and behaviors. In this way, we can see the involvement of dopamine secretion due to abnormalities in the reward system. To treat addiction, if the person is alcoholic, it is first necessary to withdraw from the addictive substance or behavior. This involves planned abstinence and behavioral therapy, under the guidance of a doctor or specialist. In the case of physical dependence, sudden abstinence from alcohol is dangerous, so caution is required. In the case of psychological dependence, counseling and cognitive behavioral therapy are effective in restoring the normal function of the reward system. It is important to address the root cause of the addiction and build healthy lifestyle habits. Support from family and surroundings also plays an important role. To prevent alcoholism, it is important to have correct knowledge about addictive substances and behaviors and recognize the risks. In this way, we can see that the cause of alcoholism lies in the brain's reward system. Therefore, the treatment to correct the abnormality in the brain that is the cause is psychotherapy. In particular, cognitive behavioral therapy and motivational interviewing have been shown to be effective from a neuroscience perspective. These therapies correct the fundamental brain abnormalities of alcoholism through the recovery of prefrontal cortex function, restructuring of the reward system, restructuring of cognition, improving self-efficacy, forming a positive feedback loop, and enhancing neurodegenerative and learning. This makes it possible to learn healthy behavioral patterns and achieve recovery from alcoholism. The effectiveness of psychotherapy has been clarified from a neuroscience perspective. What did you think? We found that the reward system is involved in the brain mechanisms of addiction, not just alcoholism. This means that psychotherapy that corrects abnormalities in the reward system is effective in recovery. Our hospital offers 4 comprehensive treatment programs. These programs are suitable for the brain mechanisms of addiction and are useful for recovery. I feel that this program is suitable for anyone, not just those with addiction. I hope that as many people as possible will recover. If you found this channel useful, please subscribe and like it. See you again.